I decided to look at COVID-19, do some research. I knew there would be a lot available. I had no idea the magnitude of the information that would be available. So I tried to take a very objective approach and just learn the basics. You could, take a more particular aspect of the COVID experience and research that and find a volume of information on whatever topic that interested you. So I just tried to make it plain and simple. So I'll start with the origin. COVID-19 was identified in Wuhan, China in November of 2019. The exact transfer to humans is not yet known. Some scientists believe that it was transmitted between animals, between species, and the transmission most likely occurred in the wet markets of Wuhan, China. Humans could have possibly contracted the virus from an animal in these markets, or during an attempt to maybe exterminate a rodent carrying a disease or something like that. A second possibility could be that the virus escaped from a biohazard laboratory, like by a lab worker in Wuhan. So, maybe they touched an animal or, got it on their hands and then took it outside the facility. So that at this time, those are the origins of COVID. The transmission, there are 3 different ways. It can move among populations through exhalation of respiration, where the respiratory droplets exhaled by one person may contain active virins. COVID is caused by the virus SARS-CoV-2. The 3 conditions that lead to transmission of COVID-19 from person to person are aerosol transmission, which occurs while people are talking or singing or coughing. Large and tiny droplets are dispersed into the air, and the tiny droplets can float in the air for minutes and even up to hours. Close contact, within 6 feet of an infected person, a second person contracts the virus by inhaling the infected droplets. Fomite transmission occurs when somebody touches an object with the active virins on it and then touches their mouth or their nose or their eyes. COVID virins cannot penetrate human skin. COVID spreads easily and can spread by those who do not know they are infected. Individuals can present as follows. 80% of the cases are asymptomatic, in which a person has little or no symptoms and will not be visibly contagious to others. With a pre-symptomatic presentation, a condition that is unique to COVID, the victim will be most transmissible about 48 hours before showing any symptoms. The symptomatic presentation includes fevers and either a cough or shortness of breath that quickly lead to pneumonia and sometimes death. I think one thing that hasn't really been emphasized is the facts regarding just this presentation, that 80% of the cases, they have little or no symptoms. According to the CDC, some of the symptoms include fever or chills, cough, shortness of breath or difficulty breathing, headache, nasal congestion or runny nose, muscle or body aches, sore throat, new loss of smell or taste, and sometimes diarrhea may be present in patients. How to avoid or reduce contracting COVID. The CDC defined close contact to mean greater than 15-minute interaction within 6 feet with or without mask. As of today, during the writing of this speech, the CDC amended that definition to say a cumulative total of 15 minutes over a 24-hour period. So you can spend 3 minutes here, 3 minutes there, but if it adds up to 15 minutes or more, you've now been exposed. Social distancing is currently the most important factor we can control in COVID. So maintaining a distance of 6 feet, the large droplets fall before reaching another person. In non-ventilated areas, if you maintain that 6 feet and wear a mask, you have more protection. And then minimizing, touching your face, your eyes, your nose until you've washed your hands thoroughly. There's been a lot of comparisons of historic epidemics or the seasonal flu compared to COVID. I really think each one in isolation is, probably, it's just everyone's so different. It's hard to compare any one of them and have any accurate information, in my opinion. Of course, I'm not a medical doctor or researcher, scientist, but this is an example of where it fits as far as where the swine flu, the flu from 2018 and 19, the flu in 2017 and 18 was quite large, and then the H1N1 flu in 1918, I guess that was the Spanish flu, that was the biggest so far. And so it kind of falls square in the middle. Another concern for us has been the effect of this virus on children, obviously because going into schools, and I think that teachers and students and we need to do the research to make sure they're protected, especially our little kids and the most innocent of our population. And what is the good news is that there are very few deaths in comparison to what could have happened from this disease. So 7% of the reported children under the age of 18, and 7%, this is globally, 7% are under the age of 18. Less than 1% of the reported COVIDs are deaths. 1% of the reported COVID-19 hospitalizations are from children under age 18. So that's good. It's less than 1%. We need to keep it that way. Ways we can effectively slow down the virus. I think this, after reading some literature, taking temperatures when a person is entering a non-ventilated space could dramatically reduce the spread of symptoms. For any place that can be ventilated, for like our homes, our classrooms, and keep the windows open. I mean, and or if it can't be done during the day when the children are at school, it can be done in the evenings, until you can get some of all that out and disperse the droplets. There's no direct evidence, I thought this was interesting, available that indicates that a cloth mask is effective in reducing the transmission of this virus. However, they do reduce contamination of air and surfaces. When surgeons wear them, they have worn them for a long time to protect any of their sweat. The nurse wipes the sweat off their brow so that it doesn't fall on the patient, they cough, anything like that. So we know that they work, but there really isn't any particular evidence. One of the things that has kind of frustrated me, that's a good word, is the politics of COVID. It really seems that our leaders have made it more about politics, and this is all of them, instead of giving us guidance and advice. It's more, it appears to me to be a lot of bickering. I don't watch the news a lot, so it's only with a little bit of exposure that I've seen. However, I did find this at Pew Research that said that far more Democrats than the Republicans see COVID as a major threat to health of the U.S. public. I guess when I looked at this, I thought I could see that, but I don't feel that it's as big of a threat. I think some things have been really dramatically emphasized, and things that could have made everybody feel differently were not emphasized. And I'd say I'd probably, even the U.S. adults in the gray area, it says the Republicans are about 40, as of July, 46% believe that it could be, what it is, at 67 for the U.S. adults and 85% for the Democrats. I would fall closer to the Republicans as far as what the threat is. And now that we have for so long been subjected to the social distancing and the closing of certain facilities, it's damaging the economy, and it's damaging our children's socialization and our mental health. So I think that cost versus benefit really needs to be weighed, and some serious decisions by our leaders need to be made. We need to continue safety measures in both nursing homes and prisons. We needed to do that before COVID, and we just need to make sure it gets done. We should, as a U.S., we have all the information and can provide statistical information regarding the deaths and comorbidity rates. We need to improve our randomized testing as well as large-scale testing for antibodies. And we already have these systems in place. We do it an influenza-like illness. Hospitals keep this information, and we can just build into that database. Again, well, this is actually not about politics. This is more about the reporting and the news being non-political and factual, so that the citizens can be educated appropriately. I think the media is really responsible for a lot of this inaccurate information that's got out to the public, and it's a real disservice to everybody in this country. And these are my references. Thank you very much. I found this to be a very interesting project. I needed to find out more about it, and I'm glad I did. Thank you.